Hello everyone, I am Dr. Prabhakara Shetty, Chief of Cardiology at Columbia Asia Hospital, Yeshwanthpur, now a part of Manipal Group. Today, as a part of the World Hypertension Day, I want to emphasize the importance of recording one's blood pressure and getting it under control. But before that, I want to emphasize the proper use of face mask in the face of COVID, because if everyone wears the mask properly, then we can definitely control it. In fact, we do not need these expensive lockdowns. If we ensure that everyone wears the mask and washes their hands properly, the COVID can be controlled. Now coming back to hypertension, this is a major health problem, and I think 1 in 3 or 1 in 4 adults have high blood pressure. Normal blood pressure is below 120 by 80 millimeters of mercury, and the new definition for high blood pressure is 130 by 80 millimeters of mercury. Now, untreated high blood pressure causes many problems, but majorly 4 problems. One is stroke, second is kidney failure, third is heart failure, and the fourth is heart attack. So these 4 major problems are the major complications of untreated long-standing high blood pressure. Now you need to understand that the risk is linear and it starts from 115 by 70. Suppose somebody's risk of developing cardiovascular events like what I mentioned over a period of 10 years is say 5%. This doubles for every 20 by 10 millimeters of mercury rise in the blood pressure. So another person who is having the blood pressure of 135 by 80, the risk is 10%, and for someone who has a blood pressure reading of 155 by 90, it is already 4 times higher than someone who has a normal blood pressure, which is about 20%. So this is important to understand. The risk is linear, and if we control the blood pressure well right from the beginning, it is possible to decrease the risk substantially. So it is important. So when you initially record high blood pressure, of course you have to measure it repeatedly and confirm that it is in the hypertension range, because occasional blood pressure readings higher is okay. But when the blood pressure readings are high, we have to take all the measures to control it. First of all, of course, we have to do the diet and the exercise part of it. So if you eat a high potassium diet, that is lots of fruits and vegetables and nuts, and low sodium diet, that is avoiding any extra salt, that will help. Regular exercise and yoga, meditation, and all these things also help. Cutting down the alcohol helps. So it's important that you do all the lifestyle measures, control the blood pressure, but even beyond that, if the blood pressure remains high, then please consider starting medications. And hesitating to take medication is one of the main problems, because you may be in the range of 135, 80, 85, and then you will think that now if you start a medicine, you'll have to take it lifelong, so you want to avoid it. But please don't do that, because hypertension gets more hypertension. So if you don't treat it, after a few years, it will be 155 by 90 or higher. So then you will have to take more than 2 medicines to control that, because early hypertension can be controlled easily, maybe with 1 tablet, but if it is kept for a long time, then you will need multiple medicines to control it, and also your risk will be higher. So dear friends, it is important to understand the importance of hypertension as a health hazard and take the steps from the very early stages of your life. Thank you very much.